Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. Our guest today is Kenna Bouvet. She owns Earth and Sky Massage and Acupuncture in LIC, Long Island City in New York. She is a licensed acupuncturist and she's a diplomat of acupuncture in New York State. And also, she has a really interesting take that we've never talked about in this show, and it relates to pediatric acupuncture. I think this is a really interesting field, and she has quite a bit of experience in it, especially because she worked as a clinician in the pediatric oncology department at Columbia Medical Center. And then she also very recently did a workshop in Oxford studying with pediatric specialists from Germany and the UK. So we have a lot of fun stuff to talk about. Kenna is a wonderful clinician, a friend of mine, a colleague of mine, and I love her energy and light. And I'm excited for all of you listeners to learn about her work and her. So, welcome to the show today, Kenna.
Thank you so much. And thank you so much for having me. It's such an honor to be here.
Absolutely. So, for the audience who may not know who you are and may not know about acupuncture, especially as it relates to pediatrics, could you tell us a little bit about yourself?
Of course. My name is Kenna Bouvet. I live in Long Island City, and I also own Earth and Sky Massage and Acupuncture, which is in Long Island City. We're a team of about 15 massage and acupuncturists. Collectively, we specialize in bodywork for fertility, perinatal, pediatrics, which we'll get to. Many of us work with athletes, performers, creatives, and of course, we all work heavily with people in chronic pain and high stress. Um, I specifically knew going into acupuncture school that I wanted to, at some point, really delve into pediatrics because I had that experience as a child. I had some chronic digestive issues, no real answers from conventional medicine. My wonderful mother sought out alternative things that could help me. And that's how we found acupuncture. And it sort of shaped my health journey from a really young age. And then through my dance career, kept kind of going back to acupuncture regularly, got me through injuries. It sort of was always this pillar in my life as something that got me back on track in health. And that's sort of what one day kind of opened up a door and something clicked, and I decided to shift careers, and I haven't regretted a day. I absolutely love what I do and feel so grateful to get to go to work each day.
That's awesome. I think the some of the most wonderful specialists in the world come from having some level of empathy and personal experience, even if it's not directly themselves or maybe a loved one or somebody in their life, um, overcoming challenges. And I think that that just gives a great perspective and really helps you put yourself in the patient's shoes, and helps you like under explain things honestly in a different way. Um,
Absolutely.
that's amazing. Could you tell us a little bit about your role at Columbia Medical Center and what you did there in the oncology unit? Because that's really interesting and cool that you had that experience
Yeah,
working there.
different. Yeah, I was lucky enough just to, one of my teachers was the program manager of the integrative therapies department. And sort of, she was one of my favorite teachers. We stayed in touch. I was graduating, and she was like, "You like kids, like, come check this out." And it's a wonderful experience. It's a wonderful program. So we're hired through the integrative therapies program, which is run through philanthropy. So we go in and we work with any and anyone, doesn't matter what insurance they have, which really allowed the work to just focus on the work and nothing more. I got to treat every age. We specialized in the oncology, hematology, and bone marrow transplant division, but we often got called out to GI or cardiology, neurology. A lot of the work was, a lot of body work, a lot of acupuncture, especially with the teenagers, and also a lot of work with the family. So we really saw it as not just treating the child or the patient, but always being there for the whole family. Sometimes the days, every day looked very different. Sometimes we got sort of your quintessential nice 30-minute relaxing treatment with the children. Sometimes we were called for an emergency anxiety attack or nausea episode, and we kind of came in quickly, not knowing much, just knowing one symptom. And, maybe the treatment was 5, 10 minutes of some acupressure, pediatric Tui Na, and some essential oil. So I
Pediatric,
really,
sorry, what was that?
pediatric Tui Na, which we can talk about. Pediatric Tui Na
Okay.
is so Tui Na means Chinese medical massage. And
Okay.
there is a specific line of Tui Na for kids called pediatric Tui Na, which really focuses on the child age, because when children are born, right, they're born very not formed, and so their acupuncture meridians are not formed, right. So their treatment and ways we can affect their systems on the body is very different than adults. um, their meridians, I was taught their meridians aren't really formed till they're upright, standing, and walking. And so before then, we're really looking at areas of the body that we can affect through massage. And tactile, body work on children is just so effective. They change so quickly. Um, there's so much chi just sort of running around, and it's also just such a great technique because it's just the hand. So in a hospital setting, you don't really need anything except clean hands. And it's just it can be very calming to the children. And it's also a modality that is very, it's easy to be receptive to, right? So sometimes in hospitals, there's a lot going on. There's a lot of this and prodding and prodding, and the kids are kind of just done. And so we provide this therapeutic touch to them, that is gentle. They are the leaders of it. They can say no, they can say yes. And then we can also teach the caregivers, the parents. Pediatric Tui Na is very, what's the word? It's very easy to teach and it's very easy to grasp, and you don't have to be so specific, which really allows parents to be involved, and have them sort of feel like they have this modality to kind of provide some agency in their children's health. And then it also kind of provides that connection with the parent and the child. So pediatric Tui Na is fantastic. I use it all the time in my private practice, but I really got good at it in the hospital because it was a very easy modality to just utilize all the time. Um, and yeah, so my work in the hospital was, very, it shaped a lot of how I work with kids because you never know what to expect. You have to have a toolbox of modalities because some modalities won't work with one child, but it'll work great with another. You really learn how to be flexible, humble, and sort of hold a grounding presence, but also allow craziness to happen around you, and you're sort of, you know, there for the ride. But yeah, it really taught me how to work with kids and to just not know what to expect, but be okay with that and just do the best you can.
I love this show and doing these podcasts because I just like learn something new all the time. Pediatric Tui Na. I'm gonna look it up,
Look it
research
up. Yeah,
it,
I'll
and
send you some books.
that's amazing. That's so cool. And I think I resonate a lot with the idea of bringing agency into the parents and the families to be able to do, self-care and just understanding the body and helping them connect with each other. I do this with the parents as well. If the mom is giving birth, and then the father can help with perineal massage or things like
Yes,
that,
yeah,
or just, birth support. And then the same thing if they have the kid, and, there's some torticollis and some neck soft tissue work, and I'll teach them like just one thing that they can do. And they just feel
so great.
so good often about being able to make a change and see the change
Yeah,
almost immediately and help to
yeah,
calm the child down because I mean we can dive into just the importance of touch, but just that touch connection is more than just the physiology of mechanoreceptors or
yeah,
meridians. It's very emotional, and
yeah,
who has a better connection than a parent to a child in that
yeah,
situation?
exactly.
So
Yeah. It's so empowering. And I think, I always say to parents, like, I want to teach you because I truly believe you're going to be more effective than my touch. I essentially am a stranger
Mm,
right now. And so giving parents that power is really, that's like such a gift if I could just do that. Yeah, and it's little things. It's like, it can be things from soothing a child with anxiety in the moment, calming their nervous system to, a child with chronic constipation and just giving some massages they can do daily to, work towards, having a bowel movement every day, or a child that has a lot of respiratory issues, working on areas of the body that we can kind of decongest with body work. And yeah.
that's amazing. Can we dive into a little bit about what you did recently in at the workshop in Oxford? It's really cool. I think you said it was very recent. Is that right?
Yeah, yeah. I went in March. It was wonderful. There's, fantastic pediatric teachers in the US, not many. I think it's definitely like a specialized field. And there's some amazing international pediatric teachers. So I sort of had my eye on these people, and some of them are my mentors. So I got to meet them finally in person. But yeah, I mean, a little bit about pediatric acupuncture generally, because I think the biggest question people are like, so what is it like with, like, needles in a little kid? And I'm like, well, pediatric acupuncture looks very different. And like I was saying, with kids and treating kids, you have to have a toolbox of modalities. So really, needles, like acupuncture needles, aren't probably like big in the conversation, especially at first, especially when I'm first meeting children. They come into play when kids are a little older. I often say I can needle babies. They're very receptive. Once you get to toddler age, there's
Yeah.
so much movement that I'm doing more body work and Shonishin, which I'll explain in a second.
Please
And
do.
yeah, and then I kind of get back to the needling later on. So, with that said, the lead up is that you can't just, do acupuncture with kids. You have to, know pediatric Tui Na, or know types of pediatric massage, shiatsu, cranial sacral, which I also have studied. And then what I was doing in Oxford was taking a Shonishin class. So Shonishin is a very specialized body work for children. It's a Japanese non-needling technique. So it is with different types of tools that are of metal, so silver, copper, and you're holding there's different tools. You're holding the tool in a way so that it gently touches the skin. And there's different techniques, like in any modality, that you can do to stimulate the skin and the body in different ways.
Hmm.
So it's a lot of what we call stroking and tapping of the skin with these very fine, specialized tools. And I mean, maybe someone listening would disagree, but I don't think there's a lot of education around Shonishin. You have to really seek it out. So that's what I mean when I said, like, I've been eyeing these classes, because I think Shonishin is very effective. It's very direct with what we're treating in the child. And, similarly to pediatric Tui Na, but in a different kind of way, it's very relaxing of the nervous system, and can really affect the different levels of the nervous system in the skin. And it really targets things that I'm working with in terms of babies. It's very effective for babies with any type of feeding issue, tension from birth, colic, latch issues, and then digestive issues, respiratory issues, as they get older. But to me, it's been a very effective modality to use, especially with the infants I'm getting in the clinic.
I would love to see that. I
I
want
should,
to
I
see
have,
it.
I take a video. I need
That's
to make a
so
video.
cool. Okay,
Yeah,
so the
and
thing that
attach it to the
comes to
podcast.
mind now for me, because so I obviously my parents are from India and we come from a Hindu culture, and I don't know about anything, so I'm kind of like speaking out of thin air right now. But
Please, no, you know a ton.
there's something that my parents have said, my grandparents have said, and people in my culture about like certain babies wearing certain, or even just people in general, like it doesn't matter, like across the lifespan, but getting them very specific metals or stones for jewelry to support their specific horoscope, astrology, sign thingies,
Hmm.
and help them with whatever problems they have. Like if there's somebody who's coming in with heart condition, digestive condition, or like a certain temperament, like very shy or very angry or very something, and then helping them to like balance. It's like we call it prana
Yeah,
in the Indian culture, and I guess that's not the right term anymore, but that's how I call it. The Indian culture and the Hindu culture, we call it prana. But it's like chi in Chinese medicine. It's the same concept of like life force or
yeah,
energy force, and then it's to like create the harmony that's required for that specific person. So you use very specific things, but it's not for massage or tapping. It's you wear it
you
and
just wear it.
you
Yeah,
put it on your
yeah,
body and you like keep it on your body to like regulate your system. Isn't that
yeah.
really cool that we have like
Yeah,
some
this is what I love
similarities?
about culturally talking because I do think like yeah, like I'll have parents come in and be like, "Oh yeah, my mom comes over and like takes the baby and just massages her for 30 minutes." And it's like they're like culturally that's just what we do. And I was like I'm always like, "Great, like keep doing that." Like I think that there's these great traditions that have a real purpose. Like they are effective. And then especially if it's within their culture, it's just so ingrained in them and the intention is so clear. I think I just love hearing about all of them. And I think, like you said, they all have like a through line. Like they'll be like, oh yeah, the grandma always massages this area. And I'm like, yeah, like that makes sense because she's like having trouble pooping or like, something. And
Yeah.
maybe without knowing it though, these like wise aunties and grandmas are doing it.
And you know what's interesting is like somebody who's listening, which is totally fair and fine, might think like, oh wow, this is all just like fake science and like what is happening here. And like maybe it is like who really knows like what's true and what's not true. And someone listening is like, well, it's true if there's a systematic review with a bunch of randomized control trials. And it's like, okay, you can't like, for example, like get the horoscope of like 1,000 people and then from birth fit them with a particular stone and measure outcomes of digestion or whatever. Like you can't,
Yeah, that might
like
be
it's,
hard. Yeah.
and also like the people who came up with these things were not monetizing on it in that way. Like, you know what I mean? It
Hmm.
was like just
Yeah.
these wise old sages that were just like, do this. They weren't like, oh, you have to
Yeah.
pay me like $1 million to do this. It wasn't like monetized like that. It was just part of the system and the culture.
Right.
Um,
Yeah.
so I'm just always curious to like think about this and um,
Yeah.
just open mind to
Yeah.
new
I mean,
concepts.
it's hard. And like research is hard in this area, especially with kids. I think there are some good research studies out there showing, oxytocin levels when you do, baby massage. There's some great German studies with hand massage and oral stimulation, right? Because we know neurologically there's a lot of similarity with um, hand and mouth development. Um, and then, yeah, I think you just got to search for it, but there is some good research out there.
I love that. Okay, so can we, I know you said that we don't really like necessarily put needles into small toddlers, but what is your process of getting families and parents and even like the children that maybe are a little bit older into this work and helping them like stick with it? What is your patient education around this?
Yeah, that's huge. And I think patient education sometimes is my biggest focus because you never know what you can do in a treatment room. I treat a fair amount of children coming in with ADHD or autism, and they're sometimes just kind of running around the treatment room, and I'm chatting with parents, and maybe I get my hands on the child at some point, and we do a little where can show the parent, but for the most part, it's education, and this kind of goes back to Chinese medicine as a whole and really looking at different pillars of our health, right? So we're looking at body work, acupuncture and body work, but we're also looking at supplements or herbs. We're looking at diet, lifestyle, not so much exercise, I would say, for kids as we look at for adults. But so chatting with the parents about, taking their health concern and their goal and really looking at sort of I want to see everything the parent can tell me and show me, blood work, tests. Anytime they've seen other doctors and had diagnoses, we take that all into account. And then, I can kind of give suggestions on these other pillars that I mentioned. And I think that that's so important because children can shift quickly, but therefore the rhythm of every day has to support that shift. So if I can get the parents on board maybe with a bit of a different diet or maybe a supplementation treatment protocol at some point, or shifting a routine with sleep or something like this, I can see the shift happen quicker than if they were just coming to me, once a week or biweekly, but really doing nothing at home, right? So I
Mhm.
try to kind of tell, educate, share with the parents that the goal is going to be reached uh, better if we can all get on board and make changes in the different areas. It's not going to just be the treatment in the treatment room. And most parents get that. I think it's hard hard in different ways, and I think this is where being a mother has really helped me. I worked with kids before I was a mother, and I feel like I gave a long homework list of things they should do at home. And then I became a mom and I was like, oh my gosh, like I didn't do any of that. That is so hard. So I think that's really actually educated me on really seeing the family and the parents and what they're capable of. And I think the greatest thing I've learned in the last couple of years is really seeing what they can manage and just giving them the one or two things so that they can also feel successful in that, instead of giving them this long list of things they should do, which sure would be great, but like, let's be real, no one's gonna attain that. So, and that's just sets up for disappointment.
Yeah.
um yeah.
Oh, wow.
And then in terms of like getting kids on board with acupuncture, I think that that too has ebbed and flowed throughout the years. I think when I first started, I was like, oh, like every kid needs acupuncture. It's so powerful. And I've really let that go. And I really, I say from the beginning, the kids run the show. They have agency, and I really try to chat with initial clients. I really try to chat with parents through email or phone ahead of time. I like to really keep the treatment room focused on the child, especially when they're older. I don't want to be talking about
Yeah.
them in front of them. I want to be talking to them. And I usually never needle first treatment. Maybe I talk about it. I offer to show them, but I never make it a must because it doesn't have to be. I've seen over the years that these other modalities are, as effective in different ways. And then, some kids really take to it and it's like awesome. We use pediatric needle, smaller needles. The needling time is much shorter for kids. I'm with them the whole time. Uh, I would say like some kids 10, 11, 12, 13, like absolutely love it. They're like little pros. And some will just never be into it. And that is totally okay. So,
Yeah. We glossed over a term you used before and said we're going to come back to it. I don't remember
yes,
what it was.
please. Oh, did I? Uh,
It was in relation to like the shiatsu and like the instrument, or did we already talk
well,
about it?
Shonishin. Was it
Okay.
Shonishin?
I don't
Okay. Yeah,
know. I think so.
I think so. I
Okay.
touched a little on craniosacral, but I feel like most
Hmm.
people, yeah.
Yeah, people know
See,
most.
this is my head. I'll
Okay.
think.
We both have mom brain right now.
Yeah.
So anybody
Yeah.
who's listening who's like,
Woo.
what's happening? Both of our
Yeah.
kids had tragedies and we've both been in the ER this week.
Yes.
So
Yeah.
we
I'm sure
are.
a lot of people can relate. A lot of moms can relate.
Yes, exactly. Okay, I want to talk specifically about the feeding issues, the colic, the constipation for like smaller babies.
Yeah.
Could we just touch on because I feel like that's a big point for
Yeah.
new parents especially. Because they're trying to navigate like firstly this whole birth process and everything's going on and they're just trying to feed the baby and the mom's trying to recover, the birthing parent is trying to recover. There's so much going on and then we have like a crying baby who's not feeding,
Yeah.
who's colicky and is like
Yeah.
not pooping and it's like that
Yeah.
trifecta
Oh,
in my personal experience, I have seen that it creates the highest amount of tension and worry and chaos in a family. What are some things that you would give as, pieces of advice or things that within your scope of practice that you offer very specifically? And what are some tangible things that people can take away who are stuck in that little
yeah.
zone?
Well, I'll start out by saying, I think the reasons for this list that you listed, right? So colic, feeding issues, constipation, there can be many different reasons. And I feel like oftentimes I get referred babies um, that like other things have been sort of diagnosed out, right? So we know like maybe there's not a tongue tie, or they've gotten it looked at or released or whatever, or there's no like diagnosis something wrong with the intestines or something like that. They've gotten tests or and oftentimes I get referred babies that are just tense with feeding, and there's no real clear answer to, pediatricians or lactation consultants. And so they get sent to me to kind of look at, and that's where I kind of really feel like I sit in that area, right? Like we can do a lot of work pre-post tongue tie release. But oftentimes too, we're just getting babies that have this like colic, kind of cranky, crying, tension, maybe digestive, upset, gassy, that kind of realm. And I think, um, you know, the treatment that I really focus on is this idea that during, in utero or during birth, there was some sort of compression in the suboccipital area, right? So we're thinking back of the neck, occiput, the first two, cervical vertebrae, right? And in this area, these suboccipitals have a lot of nerve stuff going on. And also in this area, we have a lot of the cranial nerves coming out that, go to the tongue, the vagus nerve that innervates, the organs. Um, so a lot of these things that tie into feeding or the movement of the tongue, the ability to latch, the ability to digest properly, and then just all these like proprioceptive things that are going on, right? So the baby's ability to feel its body and what it's doing. And so sometimes in birth, this congestion or stagnation, pressure, compression, there's lots of terms we can think of, but to kind of give visuals to different people, this area is denser, compressed for a certain in a certain way due to birth, and it creates like this inability of flow of these nerves and whatnot, ability for the baby to turn the head properly, right? And so what we do is we really work to ease and release that area through different um, targeted, stroking, tapping techniques in Shonishin. There's some Tui Na moves we can do, and then craniosacral is very effective for this as well. That's what I do sort of in clinic, and there's a lot more to it, but that's, Spark Note version. And then in terms of like education with parents, again, that's huge. I mean, my teachers in Germany are like, in every hospital, there is like hours of like baby handling before you leave the hospital, right? Like there's just so much education around how to handle and carry your baby. And I think here we don't have as much of that unless you seek it out. And so in my, I know a little bit, I want to know more, but I do try to give some ways of holding and carrying and helping to maneuver the baby, that my goal is always to provide the best kind of situation for the baby to help themselves release the tension, right? It's sort of this idea that if we give babies the proper environment, they can work out a lot of their tension. But if we're constantly putting them in, contraptions or swings or car seats, which I know we have to travel and do things, but if we're constantly doing that, then they
Hmm.
don't have that ability to work out the kinks, you can say,
Yeah.
right? So a lot of my education is just around like, yeah, movement and or laying them on a floor with the quilts and playing with them on either side if we're seeing a neck preference, or different ways we can hold them and try to gently stretch their necks if we're seeing, you know, the neck preference, lasting beyond when it should sort of be finishing up, right? Um, and then, I work closely with referrals with lactation consultants who I just absolutely love. And I feel like they handle a lot of the feeding positions and that kind of stuff. And I feel like I can just, make sure they know that information and encourage them to keep doing, whatever they were taught in that realm. Um, and then again, it goes back to just teaching them some massages they can do at home that help, if it's gas that's, showing up for their baby. That was a bit of a ramble, but hopefully I answered
No.
your
I think
question.
that answered a lot, and it's just so parallel with what we do in pediatric physical therapy too.
Yeah, I'm
Um,
sure.
yeah, and
I
it's
like want
like,
to know.
well, one thing that I always tell parents that are especially the moms that are coming in for just birth prep, like say there's like absolutely nothing wrong with them, and they're
Yeah.
just or there maybe there's like something unrelated to like postpartum. They're just coming in for like a little leaking or like some little back pain that's like not very alarming. I will always tell them postpartum baby handling, no matter what. I'm like, we need a session to talk about baby tasks and postpartum recovery. Like, I don't care that that's not what you're coming in for, but if you don't learn that, I would be doing such a disservice to you.
Yeah.
And I'm
Yeah.
like telling them specifically, like if I assess a scoliosis, like if I assess them and I find that there's, there's some certain things going on with their neck, their thoracic spine, their lumbar spine, or their pelvis or their sacrum, I will teach them specific ways to hold the baby so that it
Hmm.
doesn't perpetuate the
Yes.
negative compensations that are happening and actually help make them practice. I'm like, if you
Yeah.
don't practice before the baby comes,
Oh, you'll never do it.
everybody, yeah, no, they slip into the ways like I am literally a living example. Like I remember when you said it was so hard to do like the 15 things that you
Oh,
taught
yeah.
everyone, and then you became a mom and you're like, what the heck, I can't do all of
Yeah.
those things. I think the biggest lesson I learned is like you have to practice it beforehand. And
Absolutely.
if you don't practice it beforehand, you will keep wanting to just do things on automatic.
Yeah.
And then the one other thing that I also learned, which I'll tell everyone, is I used to tell parents all the time, 1 hour-ish of like overtime. You have to build about an hour of cumulative tummy time. Here are all the modifications.
Tummy
It doesn't
time.
doesn't have to be totally flat. I'll like give them all these ways to do it, and
Yep.
I'll explain to them in all of my
Yeah.
wisdom that I didn't
Yep.
have. Even if the baby has a little discomfort, you have to keep going.
Yeah.
There's like a red light, green light, yellow
Yep.
light situation. Like if they're just approaching yellow, it doesn't mean alarms
Yeah.
firing. And I used to say all these
Yeah.
things, right? And then Gia was born, and I told my husband like I explained everything to him about the tummy time,
Yeah.
right, ahead of time. So then she starts going, "Meh," and I'm like, "No, we're done, we're done."
We're done. We're out.
He's
Yeah.
and my husband came to
Yeah.
me. He's like, "What are you doing? You told me that you're supposed to leave her if she's like not actually crying and she's just like making sounds." And I'm like,
Yeah.
"No, she's in
Yeah.
really bad shape. We have to
Yeah.
stop."
No, she's my baby.
And he's
Yeah.
like,
Tummy time, though. I mean, we didn't even touch on that, but that is a huge thing. And that's probably one of my biggest things. I am pretty like highlight. I usually tell
"Yeah,
parents I'm going to be a broken record with talking to you about tummy time, but like the benefits of tummy time are so beyond what many people think.
mm-hmm,
But especially with babies that have, digestive issues, we're getting pressure on that digestive system, respiratory issues, we're getting growth and length
mm-hmm,
out of that lung. Those babies where you see have no neck, it's like really cute in the beginning, but then at a certain point you're like, there's still no neck. That diaphragm like hasn't shifted, the shoulders haven't come down, and usually it's like either they haven't been doing proper tummy time ish, or the baby hasn't gotten it, or just not enough, or but with that said, I mean, you were saying it like you give so many options of tummy time. I think that's also key, is like you don't just plop the baby there and like hope for the best. Like there's a lot of ways you can teach like how to get into tummy time, alternatives to start with, how to kind of help them get into proper positioning without forcing. And yeah, I definitely try to spend a portion of treatments like either teaching, talking about tummy time, or just having the baby get in there and kind of help and show and treat. That's how I treat their backs. And um Yeah, I am a broken record with tummy time, but definitely struggled with my kids too, it's how it
Yeah,
is.
it's hard. And I just like acknowledge that it's difficult, but like you have to keep
Yeah.
doing it. And that's the part that
Yeah.
I told them. I was like, it's hard, I know, and then keep going. And
Well, it's helpful that you told them like I struggle. I think it's helpful that we can
yeah,
say like, yeah, it wasn't like a piece of cake with our children as well.
no, at all. And
Yeah.
then like I have a lot more empathy for just like it's okay if you really truly truly feel like at day 4 or 5 postpartum you still are not up for certain things to
Yeah.
do, or day 1 or 2. There's like literally no timeline. Like I give you a
Yeah.
recommendation of
Yep.
what it could look like with certain situations, and if it's a couple of days, or I would hopefully not, it's a couple of weeks and months out off,
Yeah.
but if it's a
Yeah.
couple of days here and there off, like you are okay. Like absolutely
Yeah.
nothing will happen if day 2 postpartum you're not like doing diaphragmatic
Yeah.
breathing. Like
Yeah.
actually nothing is going to happen to you.
Yeah. Yeah.
Just relax. It
Yes.
doesn't have to be a whole
Sleep.
thing. Just go to sleep. It
Yeah.
doesn't have to be a thing.
Yeah.
But yeah, no, it's I'm sure you feel this way too, but like everything you said is still true. And then everything you feel is just with so much more love and
Yeah.
caring and knowing how important it is, right? It's
Yeah.
like
Yeah.
it is like nothing goes away. It's all so true and it's so hard. So that can't
Yeah.
like take that away from the
Yeah.
parent's
There's two
journey.
truths there. Yeah.
Exactly. Oh, Kenna, this is so amazing. Do you have anything else to add to us? Any other cool terms in Chinese medicine? No, I'm just kidding. But like really
Some
anything.
vocab.
Yeah,
No,
anything
I
you want
think,
to add.
I maybe it's come across, but I really, I feel so like excited talking about this topic. And it's just a huge passion of mine. And I think like kind of coming back to what you were just saying, like everyone gets to the point at some point, but it's different for everyone. So the postpartum journey looks so different for everyone. And that really ringed a bell with treating children. I think that why I love working with kids, but then also working with kids in this career, right? Like doing acupuncture and body work with them is I can really look at who they are as people, and I can really like what I work on the most as a practitioner and clinician is really just seeing the heart of the kid and meeting them where they're at. And that's why every treatment looks so different. Even if I'm treating constipation 5 times in a row, it's like 5 different beings and souls. And
Yep.
without getting too woo woo, it really is true though, because they come in so presenting so differently. And I think that when you're working with kids, you do have this sort of job to really just make them the best little people they can be. And um, some of my teachers here in America are just so brilliant at talking about like bringing out their superhero power and really
Hmm.
looking at, what element these kids are, what type of people and personalities they are. And really accentuating the good and kind of evening out the things that get a little off. And this really, really goes into like emotions and, when we see kids with a lot of anxieties or, you know, um, system, digestive or respiratory eczema, these things that happen because of a emotional tie, emotional reason. But yeah, just really looking at the kids and helping them just be the best little people. And I think that that's truly at the heart of why I love working with kids, because I feel like you kind of give them this gift of like being one with themselves for the rest of their lives. Like that's what I feel like I was given having this work as a kid. Like it's not that my health is always perfect, but I feel like I can seek out what I need and trust my body and listen to it and know like that doesn't feel right. Like I need this or that. And just like teaching kids to understand themselves and their bodies a little bit more. I don't know if that makes sense, but
No, it absolutely does. I resonate with that a lot. I think it's something that we really are kind of, I feel like, moving towards as millennial parents who are parenting small children, is being in touch with yourself and your thoughts and your emotions and coming forward in this world with better energy. And that comes from better health overall, like not just
Yeah.
like the health of your tissues physiologically, but the whole being. And I think that this holistic approach that you're talking about, which is all like Chinese medicine, Eastern medicine, acupuncture, it's
Yeah.
all really thinking about the person as a whole. It's not like targeted tissue, that's
Yes.
it, and we're done with it.
Yeah.
It's much deeper than that.
Yeah.
And it comes from philosophies that are ancient and that have been around for like thousands of years. And I think that speaks volumes to the number of souls that it's actually touched. And so I don't think we really need any systematic review to vouch for that
Yeah.
piece. And I don't think we
Yeah.
ever can possibly figure that out and
Yeah.
share it with the world in that capacity. So I think that's the importance of speaking about it in this way also
Yeah.
and explaining it to people because it is very ethereal and woo-woo, if you will, and but it's not at the same time, you know? Like
Yeah.
you see the
Totally.
change, you do it every
Yeah.
day, you know that, certain things work for certain people, certain things don't work for other people. Like that's also true. But the work in and of itself is comes from I think a practitioner fully understanding, and then like the energetics of how you convey that to the
Hmm.
human that you're working with as well. And
Yeah.
that's really important. And that piece is researched now in
Yeah.
the way of just patient-client
Absolutely.
interaction. And though in that language, they talk about it like that,
Yeah.
but essentially it's energy. That's what's
Yeah.
flowing between two
Yeah.
human beings.
I mean, I think that like I can't hide like with adults, you can kind of hide if you're having a bad day. With kids, like they just like can sense your energies off. And it's made me have to really leave my stuff at the door when I treat kids because they'll feel it and it'll just go downward. So they're
Yeah.
smart little humans.
Amazing. Kenna, where can people find you and your practice if they're interested in working with you guys?
Yeah, so we're in Long Island City. It's about 5 minutes from Grand Central Manhattan. And I work at Earth and Sky Massage and Acupuncture. And we have our website, earthskylic.com. Our booking site is on there. My email is also on there. I love to, if you have questions ahead of time, especially with, if it's your child, I think it's good to check in and make sure that um, you're bringing your kid in for these reasons and make sure that what I can do is going to be a good relationship. So definitely check in. Don't be afraid to email. Yeah,
And I'll drop all of that in the show notes for everyone
perfect.
so they
Yeah.
can check it out as well.
Thank you again for having me and letting me talk about this topic.
Thank you for all your wisdom and sharing this with our audience.